Welcome to The Explainer. Today, we are going to break down something super important in clinical medicine, the thyroid examination. We'll turn it into a simple, step-by-step guide you can actually use.
All right, let's jump right into a scenario. A patient walks in. They've got a swelling in their neck. So, where do you start? The obvious answer is you start with the neck, right? Well, you might be surprised to hear that in a classic clinical exam, that's actually not the first step.
Yup, you start with the hands. I know, it sounds a little strange, but think about it. The thyroid gland runs your body's entire metabolism. So the very first clues that something's up often show up miles away from the neck, literally, right at the patient's fingertips.
So let's kick off our guided masterclass right there with the hands. We're going to see just how many telltale signs of thyroid issues we can find before we even get close to the neck.
So what exactly are we looking for here? First, you'll ask the patient to stretch their hands out. A fine tremor can be really subtle, so here's a pro tip. Lay a piece of paper on their hands. It makes the tremor pop. You're also checking if their palms are warm, sweaty, or maybe a little red. And of course, you've got to check their pulse. Are you feeling a really fast heart rate? Is the rhythm off? Every single one of these is a classic clue.
And all these little signs, they're often pointing in one direction, an overactive thyroid, or what we call hyperthyroidism. Finding these clues in the hands is huge because it lets you build a working theory that's going to guide the entire rest of your examination.
Okay, so we've got our initial clues. Now let's move on to the main event, the neck. This is where we finally get to assess the gland itself. But again, there's a very specific and very smart order to it. Now, before you even lay a finger on the patient, there are two simple actions that can tell you a ton. First, you just watch the swelling as the patient takes a sip of water and swallows. Does it move up? Then you ask them to stick their tongue out. Does the lump move with their tongue? And this little chart just brilliantly sums up the power of those two simple tests. See, if a mass moves when they swallow, it's almost certainly attached to the thyroid. But, and this is the cool part, if it also moves when they stick their tongue out, that points to a whole different diagnosis, a thyroglossal cyst. It's a fantastic bit of clinical detective work.
All right, now it's time to actually feel the gland, what we call palpation. You'll have them swallow again, but this time you feel that movement under your fingers just to confirm what you saw. Then comes the most important part. You have to isolate each side. You gently push the gland from one side to make the other side, the other lobe, more obvious. That's the only way you can really feel its size, its texture, and see if it's stuck to anything around it. Then you just swap and do the other side.
But you're not done with the neck just yet. A complete exam means you also have to feel for any swollen lymph nodes, check if the windpipe or trachea has been pushed to one side, and even tap on the breastbone. Why? To see if the thyroid has grown downwards into the chest. And finally, you grab your stethoscope and listen for something called a brute. It's this whooshing sound that means there's a ton of blood flow, another huge sign of an overactive thyroid.
So from the neck, we're actually going to move up to the eyes. The eyes can give us an incredible amount of very specific information, especially when we're dealing with autoimmune thyroid conditions. Each of these signs helps paint a much clearer picture of what's going on. You have exophthalmos, which is when the eyes seem to be bulging out. Lid retraction gives this classic wide-eyed stare. And lid lag, well, that's when you have the patient look down and their upper eyelid kind of gets left behind. You're also just looking for general redness and checking if the eye muscles seem weak.
And how do you check for that muscle weakness or ophthalmoplegia? It's actually pretty simple. You just have the patient keep their head perfectly still and use their eyes to follow your finger as you trace a big letter H in the air. This little maneuver tests the full range of motion for both eyes. Easy as that.
Okay, so we've looked at the hands, the neck, and the eyes. But the thyroid's influence is massive. It's body-wide. It affects everything from your muscles to your heart. So our exam has to be body-wide too, if we really want to understand the full picture.
This systemic check is where you really see the thyroid's impact on the whole body. You can test for muscle weakness by asking the patient to stand up from a chair with their arms crossed. No cheating by using their hands. You'll listen to their heart for any new murmurs caused by the overworked circulatory system. And finally, you'll check their angle reflexes, which can be super brisk or really delayed, depending on what's going on with the thyroid.
So, we've gone through all these different pieces of the puzzle. Now let's put it all together into one clear, logical sequence that you can actually remember and use.
And here it is, the complete flow. The most important thing is to remember this path, because it tells a story. You start with the clues on the periphery, in the hands. Then you go to the source, in the neck. You move up to see the revealing signs in the eyes. And finally, you check for the systemic impact on the heart and the rest of the body. It just makes sense.
You see, this sequence isn't just some random checklist to memorize. It's a diagnostic narrative. Each step builds on the last one, letting you collect clues and sharpen your focus as you go, leading you down a path to a much, much more confident diagnosis.
So, mastering this sequence, that's step one. But the real art of clinical examination comes next. It's about learning how tiny variations, like is the gland hard and fixed, or is it soft all over, can point you toward completely different diseases. And that really is where the fun begins.